on education in emergencies, and therefore we found different partners that implement programs across like the spectrum of countries in crisis. And the main point here is that basically different partners, when it comes to children with disabilities, use different data collection tools and different approaches. And therefore, for us as an organization, since we are tracking the number of children with disabilities that we reach in our program, it becomes a bit of a problem when we aggregate these results at the global level. But also, I mean, to understand to what extent in our programs we are able to reach children with disabilities and understand who these children can be, since there could be, first of all, an issue of undercounting. And the second one is also when it comes to implementation, an issue of safeguarding when we work with these children in this context. And therefore, what we are trying to do as an organization is basically to pilot test the use of the child functioning module, teacher version, in this context, mainly camps and host communities, to understand whether we can champion and we can just use this tool or promote this tool among the partners that are going to basically request funds as part of Education Cannot Wait. And the idea, therefore, it's really to test and the use of this tool, but at the same time to understand whether we can also just promote some kind of learning, particularly training, when it comes to the use of this tool in this context. And therefore, the scope of this proposal, which I'm currently developing with the Humanitarian Inclusion and Washington Group, so there's a lot of details that are still to be determined, may touch upon 4 different questions and areas. And again, like it's not finalized, but still this could be like the 4 areas that we are going to focus on. And the first one is really just to understand what kind of domains the teacher can ask questions about. And for instance, I'm thinking of the psychosocial questions, which might be tricky, let's say, in the environment in which we work. And also, it's more qualitative kind of work where we engage the teachers and see what's their perspective with regards to what kind of questions and what areas they can meaningfully cover. And the second part is, of course, the comparison between the rating of teachers. So to what extent the different teachers rate the same child in a different manner or in a similar manner, as well as over time. So does the rating change over time for the same teacher? And the third area probably is, again, qualitative, and it's really it's an area that is about understanding how the teachers rate the child. So what they think, do they compare the children? Do they think in absolute terms? So really to understand how the teacher then decide the score for the different child. And then the fourth area is really about understanding whether training can improve the way that teachers assess their children. At the same time, can we do something in class that can help teachers to, understand better whether, like the severity, let's say, what is like the disability that the child may experience. So this is more like some thoughts about what we would like to do, and probably we will start next year as we are developing the proposal at the moment. Actually, we don't have yet the proposal, but we will start drafting it pretty soon, let's say in a month. And so this is where we are at the moment. So happy to get any feedback and also to discuss whether you are thinking about similar activities, because then we can then just compare and complement each other, particularly in terms of geographical scope, as we're thinking to work in 2 countries, probably the MENA region and Sub-Saharan Africa, but just happy to see what you are at. Thank you for your attention.
Thank you so much, Mario. Are there just a question specifically for Mario at this point, or raise your hand? Okay. I forgot to mention, we skipped the traditional introduction period in order to move right into the heart of the meeting. Please feel free to introduce yourself in the chat so that everyone can see that. And with that, I think our next presentation is from Humanity and Inclusion.
Hi, Julie. Thanks. Hi, everyone. I'm Julia McGowan, work for Humanity and Inclusion. And yeah, I've been working with Mario on the ECW idea, but I'm talking today about some of our previous work on this. I don't know if I will be able to share the thing, otherwise I'll do similarly. Oh, hang on. This is always where you can't present from the desktop. So maybe it might be easy if I just talk and then I'll share the screen later. I don't want to spend a long time looking for the PowerPoint. But essentially, I was going to talk about the research that we did in Senegal, which some of you will already know about. But in case you don't, that was there was a small-scale research that we did with the Washington Group back in 2019 in Senegal, which was looking at basically piloting this whole idea of the TV, the teacher version of the child functioning module, looking at the feasibility and reliability of it. And it was only with 443 students, so it's small scale, but I think it has some interesting things to bring to the table. It was looking at the interreliability, as mentioned by Mario just before, and looking at the comparison of results from the same children screened by 2 different teachers. So to look at, a bit more about unpacking that, and also about the practicability of using it in real school classroom situations. And as well as the data analysis, there was this follow-up qualitative survey based on focus group discussions with teachers. So there was a bit of unpacking kind of what, how they felt about it, how useful it was, the challenges and the benefits, etc., which is obviously something that we needed to know if this was going to be piloted and taken forwards. So I think some of the key aspects to say would be that the simplest, as you would predict, and the questions on the basic functional domains like seeing, hearing, walking, and speaking were deemed obviously the simplest to address, and those focused on the more complex activities like learning, remembering, concentrating, accepting change to routine behavior, anxiety and depression were more difficult, particularly anxiety and depression. So even as Mario mentioned, that might be challenging in emergency context, but in fact, in all contexts, that's the most challenging for teachers. And other findings that we had of this small scale study was, it was, let's say, positive, and I'd say it was the overriding finding was that it was a positive experience reported by the teachers, and it's important to be familiar with the student. And I should note that this was in secondary schools as well, so that was even more challenging given the fact that teachers have many students obviously at secondary level, so that was an additional challenge. But even despite that, they were still able to be able to do this, and the inter-rater reliability wasn't too different. So there was 12 students out of the 443 that had a different sort of assessment, which obviously is significant, but not hugely significant. So yeah, I think one of the things I wanted to pull out was more kind of the qualitative side. So in terms of the benefits of teachers using it as well. So I think that they themselves found it interesting and sort of allowed them to see the students in a different way, in a different light. And maybe they'd never assessed them in that way, and sort of it is away from the formal assessment that they were typically used to doing. So it's kind of a way in to them having, their eyes open a bit more in terms of what functional limitations mean, but also what they should look at in terms of supporting students. So going back to the point earlier about what's the benefit of doing this in addition to data collection. I just briefly wanted to highlight also, so that was on the Senegal study in 2019, which I say share the information if you don't have it already, if you're interested. We also have looked at using the CFM in other projects in an operational sense, but not as a research as yet, mainly because it wasn't fully validated, so we felt that it needed to be a research project to do that. But I just wanted to bring up some comments about using the CFM with teachers in an operational sense. We have done it in Nepal, for example, and we found that there were some parallels with the Senegal study. So, for example, teachers found questions on anxiety and depression particularly challenging to answer. but they also enjoyed the process and found it was helpful in terms of their understanding of the students in their class. But the training was critical, particularly for teachers in terms of their understanding of the concept of comparisons to other children. So you know how there's the part that says compared to children of the same age, and then there's the question, well, for teachers they might be comparing, unless you do full training and get them to understand how it's being used, they might think it's comparing children to the best in the class, or rather than the typical child, if you see what I mean. So there was those kinds of issues around training and really explaining the concepts, and obviously accurate translations and back translations, which are critical when sort of operationalizing it. Those are just some key reflections. But yeah, any questions, please ask. I can share the PowerPoint, but I thought it would take a while to try and set it up, so it was easier just to talk to you, given the number of people presenting. Thanks.
Thank you, Julia. Any quick questions for Julia?
Hi, Julia. Can I just ask, you said training is critical. What level of training are we talking about? What was done, and was it enough? If not, what would you anticipate to be the sufficient level needed?
Yeah, at least a day or 2 days, ideally, on the different topics. I know in Senegal they had, it varies in different places, but there's a general understanding of of disability as a concept from the sort of functional perspective, rather than medical model, because people might be coming in with a medical model of what they think disability is, for example, and then also just obviously then procedural kind of those kind of more practical things about how this is going to work. So that was maybe at least half a day on that kind of thing. But there's a definite, we tended to increase it more in the understanding the concepts of it by further training on that. But for the actual procedural part would be at least a day on that. But I don't know, others might have. I mean, you always have it. If you have longer, then you can add more. But I think it was 2 days. That would be good. But I think you could probably do it in a day, but I don't know. Probably there's lots of people telling me there's an ideal to be much longer. But at least you need to go through clearly what their role in it is going to be.
And did it stop at collecting, or did the training also include analysis and such steps?
Oh no, well yeah, the different people would have different roles. So yeah, and also if you talk for the research bit in Senegal, obviously there was different people involved at the analysis stage. They were involved in that one on the kind of putting the information. They did it more in terms of tabulating their information about the children, almost like EMIS style. That was part of that Senegal's study. So then there would be specific training on how to do that, and then there'd be different people doing the analysis. It wouldn't necessarily be them getting involved in all of that. So it depends on who you're talking about as to what kind of training. Yes, you're right. There's another separate level of training. It's like just thinking with the in terms of how to analyze the data. That's like more with the meal team and those kind of people, not the teachers. I don't know if I'm being clear. But yeah. Any other questions? Henok.
Yes, yeah, thank you. Yeah, thank you, Julia. Yeah, I'm Henok from Save Children Norway. Yes, I have read the pilot report from Senegal, and it's very interesting. It has a lot of learning. Yes, continue to what Martina asked about, training the teachers on this tool, administering this tool, understanding it is yes useful. But also maybe understanding of this tool only may not be sufficient if the teachers do not have a good understanding about inclusive education or disability inclusive education and so forth. Just based on your experience, what topics should be included in the training?
I probably should have prefaced it by the fact that obviously it's like biased in the sense that we're working in schools that we already know, so we would have an element of, rather than completely random places that we've never had any link with, so that there'll be some understanding of inclusion more than there might be in just a random school that's never had any kind of linkage to that. So I guess you would probably need extra support if you're going blind to a place that has never heard of inclusion, no concept of that. So I would have thought that would be, you would need additional support then in those contexts. But this is a place where they have at least got that heard of the concept of inclusion, but that we need additional support about this particular tool, etc. But yeah, I agree. I think and I'll let others go because I'm really conscious of all the long list of people. But I think one thing we took from it is just to say that obviously this is a data collection tool and that's the purpose of it and that's why it was designed. However, it's can we make use of this to also then at the same time support teachers in their everyday work, so that it has a dual purpose. And we found that this was, the teachers themselves were saying, oh, this was actually really interesting. And it's because anyway, for EMIS, they have to collect data. So if we could kind of combine them having to do this, as they might see it as a chore, oh, we have to collect data, let's just tick the box because we need to do that. Actually, as part of that, they get to learn something more about the children and start to think, oh, okay, maybe these children need additional support and they may need this, this and this. It kind of ties the things together. So that's how we were seeing it, because often when you bring things in an IE, it's a kind of an additional chore maybe to the teacher, and we don't want to burden teachers with more and more things to have to do. So it's trying to kind of combine it somehow. And so that's what we were trying to look at. So that there were some feedback, I think, from some of the teachers. Oh, it's a long thing. But then equally, there was like, actually, this might be useful for us. We can see that it might be useful, but we don't want it to be too long. Hence, they like the shorter questions compared to the longer questions. Anyway. Sorry, I'll stop talking.
Mario, I see you have your hand up. Is it a question that can wait, or is it?
I can't wait. We can wait to the end. No worries.
Okay, I think a lot of these themes are going to come up. So next up, Save the Children Norway. Henrik, is that you?
Yes, thank you for this opportunity. Save the Children Norway has been actually using the Washington Group question sets starting from year 2019. It has experience now with administering the Washington Group short set of questions and the child functioning module for age 5 to 17. And we have seen that these tools have been very useful for us to identify children with disability. And also we were able to disaggregate program indicators by disability. Now, based on this experience, we also would like to pilot test the CFM teacher version. We have now agreed with Save the Children International Somalia to pilot test CFM TV version. And now we are at planning stage. And the schools that will be participating in this pilot testing will be those schools targeted by Save Children NORAD funded program. This NORAD framework agreement extends from year 2019 to 23. So if we find this pilot testing to be successful, then we may have also the possibility to repeat the pilot test in some other countries who are still being supported by the NORAD program. So basically our partners are now Save the Children Somalia Country Office and the schools, or school administrations that are supported by this program. We are trying to link the Washington Group CFM teacher version questionnaires with the student register or student attendance sheet that are being administered by the teachers. And the data collection is planned to be in November or December. Taking into account the amount of time that we need to train the teachers to actually reach into agreement with the schools, then maybe data collection can be done in early December, and we will be focusing on grade 3 to 7 students in the schools. We are planning to sample about 5 to 6 schools, but the number of schools can increase again. So I would like to get actually advice and some tips about how we need to train teachers. That's why I asked a question to Julia earlier on. And also we have another question that we can bring to this session, and that's going to be what main data collection tool can the CFM teacher version questions be included in? So I think generally there is an understanding that this can be included in EMIS, but given that this is a pilot test, and then we may not be allowed to have access to the EMIS facility. So what else? Can this CFM teacher version be administered as a standalone tool? If yes, then we would like to get your advice. And also especially from the pilot test report from Senegal, we have understood that one of the challenges that the teachers faced was the lack of familiarity with some of their students. And therefore, given a large class size in almost all developing countries where we are working in, we now plan to actually make the teacher focus on like half of the students in the classroom. And we can maybe ask, for the purpose of administering this pilot testing, the teacher can focus on the first, let's say, 2 columns of desks in the classroom, if there are 4 columns of desks, for example. So how do you see this kind of proposal from our side? Yeah, thanks. I think I should stop here, and then looking forward for your tips and advice.
These are great questions and ones that we have received. So I do think that in our conversation, the topics should definitely be addressed. And we certainly, you know, while the CFM TV was originally kind of designed to be included in educational settings, we are hearing more and more about other settings where its application is desired. So that should probably be part of it. Mario?
Yeah, thanks. Thanks a lot for the presentation. I just wanted to ask you in which parts of Somalia are you implementing this? I'm asking because we have like an education cannot wait funded program led by Save the Children in Somalia. And so that I think could also be interesting in terms of, let's say, spillovers for this program, that it's a 3 years program and will be at some point renewed. Thank you.
Thank you, Maria. So we are actually, the sample schools can be selected actually from maybe one region, but we are working in 4 regions in Somalia. Galgaduud, Hiran, Karkar, and yeah. So there are 4 regions, but I think this, given the small sample size of these schools, I think we can maybe sample all the schools from the same region to ensure efficiency. Yeah.
I saw one other hand up. No, I don't see it. Go ahead.
I really want to ask a question. My name is Guy. I really want to ask a question.
Sorry.
We can't hear you very well.
Sorry, I hope this is better.
Yes.
Yeah. My name's Guy Lefnew from Sightsavers, and I really want to ask a question based on the last 2 presentations, because they've raised a key issue, and it's this. there is a great need for teachers to identify children experiencing various types and levels of functional difficulties in their classes, and in the light of this information, provide these children with enhanced support. Now, my question is CFM TV a tool that can be used across education systems for this purpose, given the comparative complexity of the tool, the need for teachers to be provided with associated training and support, class sizes, and other factors? Might other tools, such as the Washington Group's short set of questions or simple checklists, be more appropriate? I'm going back to this key issue that Julia raised, which is about helping children struggling in classes.
It's a challenge.
I'll put this in the chat box.
No, that's fine. That's one of the $1 million questions here, right? I mean, this is part of what we hope to learn in testing, and it's a good question. Martina? You're still on mute, Martina.
I'll wait. Sorry. I'll
Oh,
take my hand up.
Mario, did you have your hand back up?
Yeah, I mean, like it's for Enoch, because I think that one of the questions was about like the design. So basically assessing just half of the students in a classroom and then later on the other half. And I was just thinking instead, you could actually assess like all of them at the beginning, and then after 6 months, you reassess the whole classroom as well, because then you would have at some point some experience with all the children, even though the number is going to be large. And then basically you readjust, let's say, in terms of, I mean, like at the level of data. So that could be one way, such that you can have like the full set in the beginning and then readjust later on. Because I think in Senegal, and I'm not sure in Senegal this was done, but somewhere I think it was done like that with this kind of design where you would double check later on during the year.
Yeah, I think, yeah, so maybe one of the limitations of the Washington Group short set is that it does not capture well learning and child development related functional difficulties, but this CFM teacher version does. So it is maybe for this purpose that we go for it now. But yes, that's actually a question. I mean, now we are for this pilot testing purposes. We just want to go for a bit different approach, just by observing half of a classroom by a teacher, to make sure that the teacher has actually sufficient time and possibility to observe those that are selected for observation, provided that the teachers and students do not move from one desk to the other desk day after day. So if that's possible, then I think if this seems to be something effective in terms of working with, then what can be done is that at least 2 teachers can be assigned into a classroom to observe the classroom. So each teachers can do their own observations for a separate group of students enrolled in a given classroom. So we just want to go for this approach now, because if we just continue to do the same thing like what Humanity and Inclusion did, observing the whole in the classroom, so I think the same type of learning will be documented again. Yeah, thanks.
Maybe we can move on to UNICEF at this point.
Hey everyone, can
Hi.
you hear me?
Yes.
Hi, hello. My name is Philippa, and I'm with UNICEF at headquarters, and it's a real pleasure to be here and learn from all these experiences. I have a couple of slides that I wanted to share. Can I have, let me try and share my screen. Let me know when you can see it.
We can see it. Yes.
Okay, great. Thank you very much. So as part of these activities to test the use of EMIS, we have been working on an overall protocol around strengthening overall availability of data related with child disability in school contexts. We are of course building on past evidence from past activities. This information has already been shared in previous presentations. And I just wanted to summarize some of the conclusions that I think we took from these past experiences and studies that we are focusing and trying to address in the current testing protocol that we are carrying out. And I think there are four main aspects. So this aspect around domains. So there are certainly some domains that are easier to measure than other. The other is about disability, so the ability of teachers to provide accurate, reliable information on the child functioning module, of course, will be related to the teacher's individual knowledge of students. It's almost like we don't need to go in and test to know this. We already know this from these past studies. I think the main question now is to understand how can we work with this evidence to make sure that when we implement this measure in schools, we make sure that we are using teachers' knowledge the best as possible. We do know that the knowledge that the teacher will have on students' individual characteristics will depend not only on teachers' profile, but also on the time spent with children. So I think it will be very important as we progress in building this evidence to understand what are these key characteristics that we need to ensure at teachers' level. So the time spent with children is not only about the amount of time that the teacher spends with the children on a weekly basis, but it can also be affected by the time during the year when we collect this data. So I think it's very important that we build some more knowledge around these small details that can have a huge impact on data quality. And then, as it was already also conveyed, I think training is paramount. This is also reflected in the results from previous testing. And in this sense, we see that a standardization of the understanding of the overall conceptual framework around functional difficulties and around a biopsychosocial model of disability is really important to make sure that teachers, when teachers provide this information on the basis of the child functioning module, they have this common understanding of these conceptual aspects. We think that we do this, of course, to make sure that the data, to ensure data quality, but on the other hand, it's something that in itself will help teachers to become more aware on an ongoing basis of the child's individual functional difficulties. So in terms of actual testing of the child functioning module in school settings, we have three overall project aims for this testing. I will only be focusing on the first one, which is more related with generating data that is aggregated at school level. So in the understanding that when we think about using the child functioning module in school contexts, so we think about teachers providing information on individual students that can be incorporated into EMIS and then be used along other information available on the system, but that this information will be mostly used at aggregated level. So This first component, and this is we are currently focusing, is testing whether and under which conditions can we do this. So what conditions need to be fulfilled for us to use the child functioning module at this aggregated school level dimension. We also have this other related aim that is important, which is how do we move from this aggregated school level data in terms of overall percentage of children with disabilities in the school into having more fine and more detailed assessment of student level needs. So we are also trying to integrate a parallel protocol whereby we can use the information from the child functioning module to identify children that then can receive a more detailed assessment, of course, within what is feasible to do it in a school, based on assessment tools. So we are trying also to work on this identification of some promising approaches for some disability domains. And of course, then try to generate the needed guidance. I think schools will need a lot of guidance in what would be a standardized approach to do this in a reliable and standardized manner. In terms now focusing only on the testing of the child functioning module to collect data at aggregated level, at school level, the main study design considerations that we have so far. So we are on a testing level. So we do need to ensure that we collect data that serves this testing purpose. So in general, we have been trying to work with the countries where we are implementing this protocol in the sense of generating representative data at some level of the educational system. So countries can, of course, cover the complete school system, but they can also focus only on primary school or secondary school. But we are trying to ensure that we do have pilot data that comes from a representative sample, so that we can not only look at the prevalence of indicators that we are trying to generate, but also have sufficient data sample size for these data analysis that are needed. The data, in terms of the data to be collected at this stage, as I say, at aggregated level, data on the child functioning module, we are considering 4 levels of data that, of course, will have different informants within a school. So once schools are selected, the first level of information, of course, will be at school level. We also will need information at classroom level provided by the teacher, and then information at teacher level. And this one is really important because if we think about these core research questions on, so what are the teachers' characteristics that can affect the usefulness or the quality of the data that we are going to collect. So we do need to collect in this pilot some information that allows us to answer those research questions. So apart from basic, teacher profile, experience, the number of hours that the teacher engages with students, we would also we are trying to incorporate a small set of questions that provide some information on teacher knowledge, attitudes, and practices around disability, just as complementary information that we can use during the pilot. And then, of course, we have the student level information, which is the main data that we want to collect. And again, we need demographics and overall information, but then the child functioning module, the teacher's version questionnaire, and we are also aiming to include the inclusive education module in this pilot, also to provide some additional information on school environment and on the experience of the child in the school. The informant, as you will see for this level of information, so we have the teacher, we have different study designs whereby we compare different teachers for the same student so that we can look at reliabilities, of course, but also look at whether some individual teachers' characteristics affect the data. And we will have also information provided by the child's mother, of course, using the standardized interview that is currently our main data collection tool for data on disability through household surveys. So this is in general terms the data that we aim to collect in this pilot. And in terms of the implementation, of course, this is an implementation plan that I'm not going to look and describe in detail. Just to, in very general terms, we have outlined a study design that should occur along 6 months. It should incorporate these different activities, of course, that start with the preparatory phase, whereby we need to understand very carefully the country context, the EMI system in the country, and then move on into adapting the protocol into the country context and defining sample designs and so on. And then in terms of the implementation, of course, that would be the core of the field work, and under this principle of using a random sample, so we would need a list of schools to draw this random sample and then move on into collecting data on a selection of schools, and within the schools on a selection of classrooms and so on. We are currently in preparatory phase with 2 countries, with Mongolia and Malawi. So as I said, this preparatory phase is really important in the sense of not only establishing the overall study design, but really also customizing the protocol into the country's context. So this is a summary of the activities that UNICEF is carrying out in views of collecting data to look at ways to validate the use of the child functioning module in school context. And I will be happy to provide any more information if there are any questions. Thank you very much.
Thank you, Philippa. Claudia, I see that you have your hand up. Do you mind if we wait a moment? Emma from Site Savers, I skipped Site Savers, I'm sorry, will need to leave the meeting early. So can we go ahead and hear from Emma?
Of course, absolutely.
Thank you, Claudia. Hi, Emma, I'm sorry.
Hi, Julie, no worries. It was my daughter's first day at school today and she just got home and she's very excited and I'm not sure I can keep her outside of the room for much longer. So thank you, everyone. Other than that, you'll have a small child bouncing in soon, being very excited. Great, so thanks everyone for sharing. It's been so interesting to hear how it's all going with everyone. And of course, we've read Julia's report before and other reports where the CFM TV has been piloted, but it's really interesting, of course, to hear it all talked through. Site Savers, we haven't used a CFM TV before. We are just at the beginning of a 2-year research study in Sierra Leone where we're going to be using it, and I'll talk mostly about that. I should say we have used the full CFM before, and so we have some experience on training data collectors and using that, but more in a research context, so it's really quite different to using it in an education management information system context, which is what we're planning to do now. So our study in Sierra Leone is similar to HI. We're going to be working in schools where we've had existing inclusive education projects for a number of years. And so we're working in schools that aren't, you could say, representative in terms of knowledge and understanding of disability and inclusion. And also, very interestingly, in Sierra Leone, there has been work on the MS generally in the last few years to create this wonderful sort of online and quite modern interconnected system, which has space for disability, but and you know, in theory, all the reports can be generated that would be useful, but the question is really how that disability box is being filled and the data that's going into it, and it's not really actually clear how teachers, if at all, have been trained to you know, fill that in and what it actually is going on behind there. And to be honest, we think it's probably, you know, a huge range of different things going on, which obviously means then the data is next to useless because you don't really know what it means at all. So we're going to be working with the ministry and also the Organisation of Persons with Disabilities, the nationally representative one called SLUDI, to conduct a research study for the next couple of years, and that's going to take place in about 4 phases. So at the moment, we're at the stage where we're understanding the existing MS and how disability is included in it. So that's both understanding the theory, you know, the policies, the guidelines, what's there, but also the practice. And so talking to people at the ministry, the teachers, but also the parents, to understand, you know, what data is being captured, how, and what's being done with it, because we're actually, like Guy said earlier, what we're really interested in is what's the data being used for, both in terms of policy making and resource allocation, but for individual children, how is an identification of disability leading to onward referral and action being taken in the classroom and beyond. So the first stage, which is mostly going to be this year up till about December, will be desk review and qualitative work. And on the basis of that, we will be designing with the ministry. We're going to be adapting, so we're going to be embedding the questions within the school census, which takes place annually, which is where it's currently found. And we're going to be adapting the existing training, making it longer to include the questions. We have included space in the budget for cognitive testing, and I think we've included about a week's worth of training, which would be generous, I think, for teachers, especially based on what Julia was saying. But I guess there'll be other sort of questions, you know, we'll want to reinforce other aspects of the training on the school census as well. So I think it's good to have a little bit of slippage in there as well, and it allows a lot of space for testing, which in my experience, giving people opportunity to test asking the questions can often be really, really valuable. And then stage 2, so next year we're going to be then implementing it, so collecting data. So the teachers will be trained using the standard ministry kind of cascade training. So we will follow that, because the reality is that's how training takes place. There's no point me flying to Sierra Leone and talking one-to-one with teachers, because that's never how it's going to happen in reality. So we'll work with the ministry through their existing structures to see how it happens. I should say at this point, and I realise this might be a bit controversial, but Guy highlighted the issue earlier that there are questions around whether or not the CFM TV might be too complicated for teachers. I don't know, and the reality is I don't think anyone does. I think we've all got opinions about whether or not it's too complicated, but we have decided that we're going to also train a certain subset of the teachers to use the short set, so that we can compare the data that comes out, and then we can empirically say at the end what the pros and cons and the trade-offs, both in the numbers of children we find, but also the time it takes and the experiences of the teachers might be, and then we can have a more robust basis on which to say whether or not one works or the other. So sorry about that. Phase 3, because this is being embedded within the census, the data is going to be fed through in the standard way and analysed in the standard way, but we're also going to extract it to make sure that we do a proper analysis that we can then compare with what's being done through the existing system, and see how analysis of the data as well as collection of the data goes. We're going to supplement this with a qualitative inquiry so we can understand how the stakeholders involved in this have found the different aspects, and we can understand not just the teachers and the heads, but also the representatives at the ministry who are involved in aggregating the data. How are they finding, analysing it? Are they using it? How is it coming through the system? Does it make sense? And then also, are the referrals taking place? So once the child is identified, if a child has been identified as meeting whatever threshold is agreed for being a disability that needs to be referred, is that referral taking place? And if not, why not? Are the children then getting the support in the classrooms? Are they getting, is there a medical centre nearby if they need to any sort of rehabilitative care or any kind of social support? Are they getting put in touch with the right people? And are the parents being given the appropriate information? So we're going to do work around that, which was probably going to be early 2023 if everything goes to plan. And then we're going to phase 4 is really tying it all up with the ministry, with Sludi, and coming up with plans to how to take it forward, if any changes need to be made, and what needs to be done to either improve it and try again, or to scale up to a larger system. So to understand what's worked and what's worked less well, and how we can take it forward. So we've worked in Sierra Leone, I think, for 20 or 30 years, and we have existing plans to keep working there. So although it's a 2-year study, it's really just the start of the engagement on this. So we're trying to work just very collaboratively with them, particularly their research and development department, to kind of take this forward collaboratively, and they're being very engaged with it. So that's great. But that's what we're doing so far. And we can share as we go on. We don't really have any answers yet. Obviously, it's all just early days, but I'm happy to continue to share as we find things out.
Thank you so much, Emma. Let's see. Maybe we should go straight to USAID given the time. Leah?
Hi, yes. Hi, Julie. Hi, everyone. Thank you again for convening this meeting today and for inviting us to participate. This is really timely for some work that we're also planning. I'm here today with several colleagues. My colleague Rebecca Pagel is here too. Both of us are with USAID Center for Education in Washington, D.C. And I just wanted to situate our interest in the CFM TV and why we are planning to do the work that we're doing, which I'll talk about here in a minute. Just to situate it with a little bit of background, to say that we have a strong emphasis on requiring disability disaggregated data in our education performance indicators. And so this means for implementing partners receiving USAID funds, implementing education programs, depending on the nature of their programming, they may be expected to report on disability disaggregation. And so we issued guidance that largely promotes the use of the Washington Group tools and the Washington Group and UNICEF tools, dependent upon many factors, one main one being the level of education programming that is being implemented. So a lot of our work focuses on the primary level of education, hence our interest in the CFM TV, but we also do work with older learners, with youth and young adults as well, and the youth workforce development in the higher education space. So with the CFM TV, again, this is of great interest to us, and we talk about it with partners as a tool that's under development and a tool that may have a lot of potential to help fill a gap that we have been seeing in our reporting for our reporting purposes. We're now in the process of designing a study to pilot the CFM TV, most likely in Nepal. And this pilot study will be carried out by our research partners who are also here today on the call with us from School to School International. And this will be done through the All Children Reading Grand Challenge for Development, which is a partnership of USAID, World Vision, and the Australian government. And we have colleagues from World Vision here today as well. The study is going to test the validity and the reliability of the CFM TV. in producing disability data that can be used to disaggregate learning outcomes by disability in early grade learning programs. So we're interested in knowing, in our early grade learning programs, are our programs reaching learners with disabilities, and are their education outcomes benefiting? And so in order to know that information, to be able to have that information in the absence of disability data already being available in certain places, we want to know if this tool can be used by teachers to help disaggregate the learning outcomes. So our study will look at how the CFM-TV performs in the Nepali primary school context. And I'm going to say something that may be a little controversial. We're going to be making comparisons of to data from medical screeners, likely only in the hearing and vision domains. Also looking at making comparisons to data of caregiver responses to the CFM, and also and other potential data sources that may be available. We will not be carrying out the medical screening through this study, but we will be relying upon the availability of that data that already exists, which may of course be a big limitation to the work that we intend to do. This study will also, like many others have noted in their study designs, investigate teachers' perceptions and interpretations of the CFM-TV questions. We're asking several questions about the reliability of the information that teachers are able to provide using the tool with their students, and whether this changes over time, and also looking at other factors. In terms of timeline, we plan to, so we're very close to completing just the research design. We intend to have that completed the end of this month, the end of September, with the goal of starting our implementation during the current school year. So during the current 2021-2022 Nepali school year. School has started back up in Nepal as of last month, and we anticipate beginning our research after teachers have had at least 3 months of interaction with students, if not more. We're also anticipating, if we have the resources to be able to do this, collecting data at 2 time points. Again, the first no less than 3 months from the beginning of the school year and when teachers have had a certain level of familiarity with their students, and then a second time point further out. And I think I'll stop there. Happy to answer questions. Again, I have several of our colleagues on the call today too, who are the ones actually designing this research. So if there's specific questions about the research, I may punt it to them.
Thank you, Leah. Shelley with World Vision is next. Shelley, are you ready to?
Yes, happy to go. Thank you. So mine will be quite quick because although World Vision has quite a bit of experience using the CFM in lots of different country programs, we are. So I will say I'm presenting on behalf of another colleague at World Vision, our disability advisor who couldn't be here today. But so more details could definitely be provided by our other colleagues if we wanted to follow up. But World Vision is exploring using the CFM-TV in the context of a USDA-funded Food for Education project that we currently implement in Malawi. Our World Vision country office in Malawi is implementing that project. It's called Educating Children Together. It's as typical Food for Education projects. It has a nutrition component, which involves school gardening. It involves strengthening literacy instruction and literacy support for children through our Unlock Literacy program. It also includes school meals, increasing community and family engagements, and health and nutrition outcomes at the ECD level. So large project. It's definitely a program example. Our hope is to use the CFM TV in about 160 schools with 1,300 teachers, and really focused on identifying difficulties that exist, prevalence across a classroom, and tailoring coaching, teacher coaching towards those difficulties. The hope is that we can integrate the CFM TV into a mobile data collection and a dashboard tool that we have called Mika. We already use that for coaching and monitoring, and it's a tool that allows us to integrate training on administering the tool, not only to teacher coaches, but also to, for instance, some of our food security personnel or people that might not be as familiar with the teaching context, that we would be able to build in all of the protocols for that into the tool. I think in the terms of Malawi, the context, it's in the Nampula province, where the study would be situated. We have a 5-year kind of time frame for it that began in 2019 and will continue until 2024. And it's really, like I said, just designed to be kind of a program improvement and teacher coaching tool. So not necessarily on the research side of it, but the program side. So we're really interested in better understanding what level of training and enabling conditions are recommended for the teachers, and for our staff to be able to give for the teachers to administer that. And then possibly if we could extend it to some of our reading camp facilitators, and what the kind of contingencies would be on that, and then how often. So the questions around time points and things like that are really interesting for us. But I know that was kind of a quick example, but just wanted to share that in the context of all of the other uses of the tool.
Thank you so much. Thank you to all of our presenters. Are there any initial questions specifically for our last couple of presenters, Philippa or others? And I do want to come back to you, Claudia, because you had your hand up and we skipped you.
Hey, Julie, Claudia had to step out for a minute. She will be back in 2 minutes, and she definitely will want to address some comments. Thank you.
Sure. Well, we're at the stage where we can engage in any kind of sharing and open discussion and questions. So I feel free to raise your hand or just unmute yourself and speak up.
Hi, I had another controversial one, bit like when people are saying the controversial thing about comparing it to, you know, other ways of assessing children, etc. It was about the comment Emma made earlier, this issue of after you've used the CFM TV or CFM, what then next happens, and it's this issue of referrals. And I think this is always a sticking point, and with our organisation too. You know, people want to think, great, we do that, and then we refer on. But obviously, you're going to. It's not diagnostic. It's not medical. However, obviously, it can be a helpful first step to you know, when you have nothing, to give you a bit of an idea as to what to then do. You know, which children are the most likely to need support with X, Y, Z. So it was just to bring up that as a topic. We found that, you know, it doesn't always correlate, but it can help. It doesn't always correlate. So, for example, with hearing and vision, you might have children that have, you know, a lot of difficulty according to the teacher, but, you know, they might not great, they might not go on to need anything, but it doesn't necessarily mean they have a diagnosed disability, but they might have some difficulty in, but not then need something. Equally, you might miss children whose teacher thinks they've not got any problem because they're not rubbing their eyes, or they're not causing some, giving some indication that they have a problem, but actually they might be the ones to need some support. So I'm just thinking that this thing with referrals, it's a sticking point, and I just wondered what others think about it. I mean, we've tried different ways. We're looking at some difficulty to be safe, even though that's not in the criteria. But we would, when it comes to referrals, we'd include that because we don't want to miss it. But even children with no difficulties could well have some difficulties, and you might have missed that group. So just wanted to put that out there to what other people are doing on referrals, or whether that's a different conversation.
Thank you. I don't want to have to call on people, so please jump in.
Yeah, okay. Yeah, go on, Leah.
I thank you, Julia, for bringing that up. I think it's an incredibly relevant, timely, and important point. And I think you said it perfectly earlier. I think it was in chat where you characterized this as a balancing act. It really is. It really is. A lot of this work is a balancing act. And I think the way that we have tried to approach this work at USAID is to say that, this is not a means to an end. We know that we're not in the perfect situation right now. We don't have, all of the tools in our toolbox that we need to provide a really comprehensive, inclusive education to children with disabilities, which includes what you talked about, the referral system and provision of supports and other services and linkages with the health sector. But in the absence of having a perfect right now, we have something. And so I think we try to couch everything that we're doing too, and in our discussions with partners, and kind of that recognition of being aware of a lot about the limitations, also the ethics involved in doing this work, and really recognizing that we're all trying to learn and inch along as much as we can in the right direction. And so, meetings like this, conversations like this, where we can be open and really share what we're doing, and hopefully what I would love to see, and we're certainly happy to do this on our side, is really share out what we're learning in real time so that we can all collectively as a community try to inch along in the right direction. So I don't have an answer, but I just wanted to acknowledge and appreciate your comments, Julia.
So if I could jump in, I work with Leah and the Center for Education at USAID. And I just want to remind us all of the fact that, the CFM TV, it was validated originally for the purpose of, collecting census level, population level data. And we are trying to bring it down to the school level because it fits our need, and there's an argument to be made that we're still looking at prevalence at the school level. But I think there's a finer line that we can easily cross when we're working at the school level, from just looking at this data as prevalence data that we're going to use to disaggregate, in our case, learning outcome data, to data that we can then use to understand something about an individual child. And I think that's a fine line. I would love to hear others' thoughts on that, because I think we're really hesitant to cross that line, knowing the original purpose of the CFM TV, and also knowing, as you just mentioned, that there isn't, so far in the data that we've seen, and this is one of the reasons we want to do another, kind of replicate some studies to compare the CFM TV's results to some medical screeners, because there doesn't seem to be a consistent, constant relationship between the two types of tools. So yeah, I'll stop there and let others contribute.
Maybe I'll jump in because my question was similar. Do you want to go, Julia?
I was just going to come back on that, but you go in, and I was just going to.
Yeah, no, Hayley knows this. I've been ranting about it before, but I think I really want us a little bit to, I want to understand what the, where that breaking point happens when we go from program and school data to population data. Because speaking, by the way, I'm from Save the Children. I'm the global lead for disability. So what Henok is doing, and with Save Norway, we are obviously piloting this in Somalia. And Mario, happy to talk about continued joint piloting through the Somalia office as well, if it goes well, etc. But you know, and Maya is here as well from our team, who is the research and evidence for education. So what we're working on, we're moving into a new strategy in the next 3 years. What we're working on is a massive push on understanding how well we work with children with disabilities. Can we actually affect change? And obviously, learning and you know, learning outcomes is one of our 3 pillars. So Save the Children is really like there now, and what happens with these pilots is going to be absolutely crucial for us, because we are from now we are, you know, collecting disability disaggregated data across our different thematic areas. But when it comes to education, we are right now at the crossroad of making decisions of which module we are going to use. And I'm hoping this will be the to-go-to module for any collection on functional difficulties when we cannot ask the parent or the child, right? We actually have some thoughts about triangulating our pilot by asking children as well the same questions. Yeah, so we I don't know, Handicap has the most recent conversation with Somalia. I'm not aware if there's a decision on that yet, but and that has to do with feasibility. So again, when we talk about this on program level, so now we're talking about 5 to 6 schools. Someone was saying a much higher number of schools. That's fine. But if we all of a sudden want to move to all the schools we're working in Somalia, we're going to have a problem, because we can't. First of all, we don't have the capacity to train teachers for 2 to 3 days, every teacher that are in those schools. We don't, first of all, we don't have permit. We don't have access to the school. It's up to the school administration to decide if that should or should not be in the teacher's job to do, because it is an added burden for them, right? So we need, like Julia was saying, we need to integrate it into the school administrative system so that it is part of the job without being seen as something extra. At schools, you know, it can't be at school starts, because then you don't know the pupils left, so you have to wait a while. So I think this is what we need to start to talk about and to understand, because in my world, the idea, and I think this is where we come together, all us different agents can come together and try to get it into the government EMIS systems. If we do that, it will, you know, it wouldn't rely on Save the Children collecting the data, Site Savers collecting the data, HI collecting the data, or NORAD or USAID or whatever it is. Then it would be in the system. That's where we want to reach to. But in order to do that, we need to cross that line of Save the Children's own program. To be honest, often, not always, but sometimes read data, meaning collect the data just to know the number. Sometimes linking it to inclusive programs and the pedagogy and all that and the bigger efforts. But that's only when it is collected through inclusive education designed programs, right? With a lot of budget for teacher and parents and child development. So my questions are, how do we get into, because it's not in the INGOs like ours control what a school district decides to do in their school. We can influence and we can be there, but eventually it's going to have to be a government decision, and where there is government. So I'm curious to know, how do we because I think together, all of us, we can, you know, we can get there. Of course, first we need the pilots to see that it works, but it's still something that we need to think about. And for us as an organization, we really, I mean, I don't think the CFM 1 and 2 will work in classrooms. It's too long. I think the short set is not good enough. But I do also think that this is prevalence data. Yes, we can link it to other type of questionnaires and other initiatives and other strategies for developing inclusive education in that specific school, but it's new, you know, still separating those two things. Sorry, but yeah, so I'm very curious where we are going and who others are doing. How do we convince schools, and what do we do when it's all of a sudden 160,000 students, or like if we're talking about reaching a certain percentage, let's say the children with disabilities, then we're talking like 3, 4, 5 million children. How do we do that? I'm gone, sorry.
Julia, do you want to go?
I had some thoughts that were linked to that, but also what I was going to say around this issue about separating out the two major functions, because there's the whole, like, we want to be collectively positive. Like say, we need to have the pilots, but something that works in terms of the EMIS level, because this is like a strongest chance of having something that is going to actually reflect the true situation of children with disabilities in the countries that we're working. Like, so from a data point of view, we want that to be robust. So it would be good to have a kind of collective voice on that, whether it's the TV or whichever one, rather than starting again with a new tool. So I think that we should collectively be really strong on that. And then separately, there's the thing about the referrals and whether that is or isn't. For me, I feel like they're two separate things, like chalk and cheese in a sense, because we know we're not going to get the same results. Like, we know already before you even start, we're going to have different children identified through the CFM as by some bunch of medical people looking, because but as you were saying about feasibility, we won't always have those medical people to go and look at who is in every school everywhere. So we're going to need this kind of, it's useful in its own right to have that first level, but it won't bring up the same exact children. So in a way, I'm kind of a bit nervous about the comparison with other medical screeners, because I feel like we aren't going to get exactly the same information. But in a way, is that therefore should be therefore then say we shouldn't use it? Not necessarily, but we should just be careful how we use it and careful what we we don't start labeling children based on the CFM TV and saying, right, this child has is in a group with all the children with hearing impairment or something like that, when we don't know. We just know that there's some difficulty. So that was kind of my point on the referrals, just to have it as err on the side of caution. If you have some children who are flagged in any way, then go ahead and assess. You might find different results, and that's kind of fine in a way. It's just the first level. But yeah, I think we should collectively be really strong on, as you said, Martina, on the potential that this has. And the only one I know, I think it's Mali or something, and then also Nepal, where they're trying to get in the EMIS, having CFM within that. But the Nepal one, I know that the kind of early days, it's a pilot, but that's something to base on, and I'm sure there's others in other countries. So if we kind of have a strong push on that, that's the way of making it, that it isn't us trying to do it in our different organisations, but it's actually the government doing it. There's always the Fiji example, but I know there's probably some others nowadays.
If I may jump in, I mean, like with Education Cannot Wait, we are trying to do that work with the government, because we have like these programs that we call multi-year resilience program. And what we do is that we basically develop this 3-year programs with the government and with the education group in the country, being the education emergency group and the local education group. So that's some work that we're trying to do with the EMIS to get that information in there. And then, of course, there's the question, what kind of tool? And I think that this point links back to the presentation made by Leah, but also with the point that you made, Julia. I mean, if we are comparing, for instance, results based on a medical model with results coming from a tool that is based on a completely different model, which is the functioning model, and that's more rights-based approach, and it's about participation and risk of exclusion, what do we learn at the end of the day? Can we really compare results based on two different models that are two different things? And I think that this also like kind of links back to the question of can we go from the school level to the individual level? And I mean, like in my opinion, my personal opinion, I would say yes, we can go to the individual level as long as we consider the CFM something that helps us understand what is the risk of exclusion of a child in the learning experience that he or she is having at school, not by labeling and categorizing. So if a teacher knows that a child might have some kind of difficulties being little or like more severe, that is still something that is useful for the teacher, and then becomes programming. Then if we want to go like to a higher level and just bring it into the EMIS, then there is a question whether we can use that and whether we can use that specific tool. And that's why I guess that we are all like interested in testing this as like research, and then just move to the higher level. But I would think still that we can use it for both programming and for the EMIS. But of course, we have to be clear about that the objective from the very beginning, whether it's specifically for programming. And for us, for instance, it might work in a refugee crisis where you don't have that connection with the EMIS, but you still want to understand who are the children at greater risk of exclusion. And then in other programs like the multi-resilience program that it's work that you do with the government, probably you might want to use this tool and test it and see whether you can provide meaningful information that goes into a national system. That is just, yeah, at least my perspective on a few questions that were raised, because we are talking about like a lot about comparing. Sorry, that's my daughter. But we are comparing between teachers with caregivers. But I think that at the end of the day, it really just depends on what is the objective, why we are collecting this data. And it boils down to me, at least for programming or EMIS related kind of information that you need.
Philippa, did you have your hand up? I don't want to go before you.
Thank you, Jennifer. I had, but what I was going to say was somehow conveyed by someone already. And I just wanted to add into what was said about differentiating between what we need to know now in terms of, you know, these questions to answer aspects such as, so when in the school year should we be collecting this data, or what do we need, how do we need to train the teachers and so on. So all these research questions that we have now and that we are hoping to answer will serve to generate, hopefully, a set of recommendations that, you know, are evidence level, that build on a shared body of knowledge, and then that countries can then incorporate, you know, but countries will need to own, right, this what follows. And so I would like just to separate then what follows in terms of implementation challenges and customizing all these evidence-based recommendations into what's feasible at country level. So I think that part of this body of knowledge that we need also to construct now is to understand what will be these implementation challenges in the field, and how can countries then move on from these research-based recommendations into what's feasible in such way that at least a minimum of standardized aspects are fulfilled, I would say. But a lot of customization will also be required because, as someone said, we will not collect the data for countries. What we want is for countries to incorporate and do the rollout in such way that it's useful and it fulfills their needs, basically. So I totally agree with this, you know, aspect on the implementation, customization challenges. That was all. Thank you.
I just wanted to mention two things. One, I felt like I had to say why Leah said that it might be controversial about the comparing to the screener, because that comes from a conversation that she had with the Secretariat a while back. And it is really not because doing such a comparison won't provide useful information, particularly on this issue of do you want to use it for referrals. It was more about how do you do that. And how best to do it, because I think we tend to assume that a objective medical screener will give you truth, and that turns out not to be the case. And more so, when you're looking at why there might be disagreement, you really want to know a lot about how that screener was done. So if you have a screener that is, yes, the child has a problem in hearing versus no, you don't know really, are you missing, is the kind of off diagonals when you ask the teacher, because you're missing children who don't have a lot of difficulty, so the teacher might not know it, or are you missing children who have a profound difficulty? So I think that how you design that particular test is very important in terms of
how you can use the information that comes out of it. It's a little easier to use some of the others also because the availability and your control over the medical screeners is probably a whole lot less than your control over the teachers. And we're already worried about, you know, left to their own devices, what are they going to do? But I think this also kind of relates to this broader question. I think it was also in Philippa's first slide of, I don't think the question is, does the CFM TV work? I think the question is, where does it work? And how can we provide guidance about when it would be more likely to work, and also for what domains does it work and when? So then you'll know that, well, there's some domains that in these situations it's probably not worth doing because you're not going to get good information. But as times change and programs change, one of the main reasons in a bit, yeah, if children can answer, that would be great as well. Might be even better than having a medical exam. But one of the reasons that we have the self-serving reason that we wanted to bring you all together, and at some point we'll, not now, but we want to leave a little time at the end to talk about next steps, was that we said if we brought together all of the results from all of the testing, we would have a much better idea of when it works than if they were just individual studies that may not be joined. So that's kind of a, you know, what we might want to discuss in maybe 10 or 15 minutes in terms of what might we want to do after this, which is really completely up to you guys about how you'd like to move forward. So thanks. Canuck, you had your...
Okay, thank you. Yeah. So now I think what we are trying to do in Somalia is also, I think I didn't mention earlier on one point, in addition to making analysis of inter-rater reliability by making two teachers assess the same children. We also try to administer the CFM TV directly with children, those who were assessed by their teachers. This will also help us to see if there is agreement between child response and the teacher response about that same child. So this may enable us to have a look at this data collection from different dimensions. But then my question is, in the presentations that I heard now from our colleagues, I didn't hear, if I missed anything, I'm not sure, but I didn't hear any organization also trying to administer CFM TV directly with the students or children. So my question could be like, why are we not doing this? I mean, if maybe children can also assess themselves correctly, can't we have a look at that? Because my previous discussion with some Washington group experts, especially I think Mitch, he is the support provider for us, and he said that they did do a testing of the CFM version by directly administering it with children who were 11 years old and above. And so they observed general agreement between responses that were gotten from parents and those that were collected from children. So this I think now our objective is going to be, maybe the last objective is going to be maybe to make a MIS contain good quality disability data so that the education system at large and each school will be able to actually adjust its programs and decisions based on this data. But now we are still figuring out how we can do this. Still we are examining if the use of a teacher can really give us reliable data. And then can't we also test if students can also provide reliable data. And also, I think side by side with this pilot testing, there is something that needs to be considered, and that is advocacy. If we, for example, get some learning from this pilot testing, like, for example, that we see that the inter-rater reliability is high, that we maybe from one pilot test, we can believe that teachers can assess students. So in order to enable the government also move alongside with us, then we can do advocacy based on the pilot test findings. Because I think the end aim is going to enable the government to do data collection by itself. Just taking into consideration, I mean, all the scholars, and in a way that it has to allocate resources for such data collection. It has to put this as one of its budget items. And so it should be the end project. And then, so when do we start this advocacy? I think it should start as early as possible, based on the pilot test findings from each specific country. Yes, thank you.
Claudia, would you like to jump in? She may not be back. Others?
Just can I ask about the age of children? I was just reading what Amy was writing about the FCDA. I know at Girls Education Challenge they did use is it 11, 12 plus on the short set, I think, in those projects, if I'm not wrong. But it just reminded me of this whole question around, we always felt that, you know, it was you weren't supposed to ask children, let's say, in the guidance, but that this might get over the issue, particularly of the challenging questions for teachers to ask around anxiety, depression, etc., etc. So I wondered if there was a collective, you know, point of view on teenagers or which age group and etc. Yeah, it was more, I guess, towards the Washington group, that one, but I guess others as well.
You're on mute, Jennifer.
Sorry, yeah. That's another thing we get a lot of questions on as the Secretariat in terms of the CFM, is whether kids can use it. And then the kind of related is also around humanitarian use. So this is, we kind of pulled this on the TV to pull in different things, but not children. And Julie just put, or Heidi, sorry, put in the chat that our colleagues in Finland are particularly interested in this and are doing some work. The test that we did in the US, I didn't think it went down to 11, but I always forget exactly what that test. I thought it was older ages. I thought it was at least 15, but I could be remembering wrong. But we have that report. If people are interested, we could send it around, the report of that testing. And there was a whole lot more consistency than we thought we were going to find. But I think there again, it's probably domain specific on some things, and also probably country specific. I mean, just how well those things go. It is hard to say. Our testing was only in the US, and I'm not familiar with the FDCO stuff, and the Finns, I think, have just started or have at least some results, but we certainly can share those, and depending on what our next steps are, I think they would be interested in learning more of what other people are doing about child administration.
Yeah, maybe I'll jump in to build on that, Jennifer and Julia. I'm actually here with USAID on the work in Nepal, but part of the other work I do is with Girls Education Challenge, and every project is approaching it a bit different. The Girls Education Challenge projects work from 10 to 19. Some projects are doing administration with both the children themselves and their parents, and then we have those two pieces of data that we're trying to sort of reconcile and who's right, which is a big challenge. Some are just doing it with the children, some are just doing it with the caregivers. So there's a mixed bag and a ton of data that I would personally love to have more freedom to look into, but that's sort of also driven by FCDO's interest and where the money goes. So so maybe if there is interest in sort of mining that a bit more, that would be a conversation we could definitely have.
I think there's a lot of interest around that. Claudia, did you want to say something? Your name is up, so maybe you're back. If not, that's okay. I don't know if there's no other comments on the presentations. Maybe we can move on to the last thing on our agenda, which is next steps. And as Julie said at the beginning, we've called you all together because we were getting a lot of questions that we couldn't answer. And it's really frustrating to us not to be able to answer. And we have, I think, over the years, the Secretariat has started to act as a clearinghouse for a lot of information. We get a lot of requests for, do you have a translation of X? And we're happy to provide that. But this set of questions were things where we were assuming that there was work going on, but not really aware of it ourselves, other than in some selected instances. And saw there were a lot of different groups involved, so thought it might be a good idea to just get everyone together without any real idea of what might be a next step. Leaving it to you guys who are actually doing the testing, because we are not doing the testing. If there's a way that the Washington Group Secretariat, or we do have a work group, we do have a child functioning work group that has been doing some work, but not a lot, particularly because of COVID, but we still have it, and it could be a home for some work if you so want. We're happy to continue being a facilitating group and bring you all together as often as you want, or provide some other kind of structure. So it seems like through the conversation there were some key issues raised that resonated across many of the topics. You could kind of envision having a particular conversation about any one of them in more depth, trying to think about next steps, when data become available. Is there some interest in doing some kind of, not joint analysis, because they are different projects, but somehow bringing together results, but using maybe a consistent way of looking at the data so that we can maybe draw some other conclusions. So these were just some ideas that we had about what this group could do moving forward, but it's really what the group wants to do. And also, as we mentioned, that the invitees were people who contacted us. That was a good way for us to identify the universe for this call. We assume that there are other people out there that we didn't necessarily know about that are doing other things. We could do something to try to find them. You may know others that we don't know about. We can certainly put something on our website. We can ask members if they know anything. But this group was just, as we said, a convenience sample because we knew who you were and we knew you were interested, and it wasn't a huge group. So we thought this was a good place to start. So let me leave it there and just open it for whatever comments ideas anyone has. And if this was just useful to do once, that's really fine as well. No pressure here.
I'll jump in. Oh, no, go ahead, Julie. Sorry.
I'm sorry. I'm going to do what I should not do and interrupt and just mention that if there are reports to be shared, you can put the links in the chat, or you can send them to us and we will disseminate those back through email. And shameless promotion, but if anyone wants to write a blog about their experiences thus far, we very much appreciate those, and we find that those blogs are very useful to others. The fact that we are not authoring them, they can see those experiences and those programs from others is very helpful. So I'll stop there. Go ahead, Leah.
Thanks. I just wanted to say, wow, what an incredibly generous offer. And yes, I can say from USAID's perspective, we would be very happy to continue to convene with this group. And if the Washington Group Secretariat has the bandwidth to be that convener, I think that you all are really best placed to bring people together. And we would certainly participate and be very happy to help in any way that we can. A couple of just kind of very basic ideas to throw out and see what others think, certainly as well. But we would be happy to share, the basics about our planned research. Maybe it would be useful to have even just a very simple kind of spreadsheet that has, the basic details of what everybody here shared today, and those who are comfortable to have that up perhaps on the Washington Group's website as a starting point might be useful, and might be useful too to try to identify other partners and colleagues who are doing some of this work who could also add to that. But yes, I just wanted to say thank you, and we would love to continue to participate, share resources, tools, what we're learning. We have platforms too that we can use, mechanisms that we can use to organize learning sessions with partners. We'd be very, very happy to do that. Would love to help contribute a blog, co-author a blog with others on this call. So just, yes, please count on us, and we'd be very happy to continue to participate and learn from everybody here.
Anybody else?
I had equally, it's been really useful. Some of those are really good ideas. I had a specific suggestion, although not necessarily offering, but the Global Disability Summit that's coming up. I was wondering if that would be an opportunity to kind of do some sort of complicated to do collective things, but a collective presentation or some sort of coming together of this as a topic, and a kind of really clear vision of what what's going on, and maybe just as a talking point. I don't know, because I guess all the ideas for that are sort of a bit up in the air. So, but yeah, just throwing it out there as an idea. And I know Mario might add on that, because I think you were thinking about that as well.
Yeah, I mean, like in line with you, and also I think Marius brought up the point in the chat, but I mean, like we are working with the inclusive education task team of the GLAD network, and basically at the moment we are putting together a set of recommendations for commitments that participants of the summit can take, and one of them is specifically about data. So if we can bring some content to that discussion, I'm sure that we can get commitments that are more fine-grained than those that were taken, for instance, a couple of years ago, 3 years ago. And probably, we can do that through this group. And as Julia suggested, we can have like a joint presentation, or share the experiences of the different pilots, because we are at different stages. Some of us are like in the design phase, and some others might have results by then. And so it would be good actually just to provide probably some information on how this can be done and where this can be done, as Jennifer has also highlighted, because there are differences in this context, emergency context. So this could be extremely useful, I think. And then of course some results, and then just come up with recommendations probably for the knowledge that we have so far. And we can do that as part of like existing networks like the GLAD again, because I remember there's also a data group in there. And of course, like the Washington group, if as the time and will to do that, probably, yeah. And moving forward would be also good for, if someone wants to share about their designs or like something like that, probably can also be something useful for the work group. Thank you.
There was just the Inclusive Education Working Group just met, I think it was last week or the week before, and we didn't want to say anything at that meeting because we hadn't met yet, and maybe this would have been a one-off. But if it's okay with everyone, we certainly can, and whoever wants to can report back. We can ask for some time on the agenda for the next meeting, which I'm not exactly sure when it is, but to talk about what we're doing. Yeah, it would be great to do something at at the Global Forum as well, maybe on the more, not in addition to the recommendations about data, but maybe also about all the good work that's going on, a way to highlight it. A related thing is the Washington Group annual meeting is in early November. And in thinking about the agenda, we were wondering whether we might include a session on this topic. And if anybody from this group might want to present, it doesn't have to, we're very flexible in length of sessions these days, and it is of course virtual. So I forgot exactly how long they run, but what were we thinking, about an hour, but it could be less. We couldn't have everybody present, but we might be able to do some kind of summary, maybe highlight one or two, but that would another open for conversation. If it would be okay with everyone if we at least talked about this meeting at our annual meeting.
Jennifer, who attends those meetings and who would the audience be?
Well, the invitation goes out to the members, which is a loose term. So the primary members, remember, are the NSOs. And they're about 133, and they all don't show up, obviously, but there are technically around 133 member countries. And because the Washington Group is under the Statistical Commission, the memberships are the national NSOs. But then we have this much broader mailing list of adjunct members and all kinds of things we made up to include people that also can come. So it is more, for that point of view, is more to let the member countries know what's going on. And that they often are not called on to deal with MS systems. That is true. That is usually outside the purview of most statistical agencies, but it is good for them to know, I think, often they're the disability focal point in their NSO, that this work is going on based on things that they did. So it sometimes helps them to say, look, we developed a CFM, and then now now it's being used in this, and other people in your government are using it. So it's helpful. And then many of them are just very interested in the topic. So they kind of, because they're data nerds and they like worrying about this kind of stuff. You're welcome. Everyone is welcome to come to the annual meeting, and because it's virtual, you can only go to some sessions. And we don't take it personally if you decide you don't want to hear some stuff. But we were also going to do something on humanitarian data collection in humanitarian areas. We might be calling on you, Mario, and also we have some other work we're doing with UNHCR. So again, it's more to be more inclusive of all the work. Maya?
Yeah, I think it's all great, I guess, coming from the sort of programming side. We just see such a desperate situation. I've been quite recently working in East Africa, and we make it as good as possible and as better as possible. But I think based on these pilots, we need to, really push forward the use of data, both the collection and the use of data. And I'd almost suggest, if there could be some small meetings with maybe heads of humanitarian aid in a small number of the largest INGOs, perhaps with ECW and GEC, and just sort of get together and make a commitment that as the sort of top 5-10 agencies we're going to use, whether we choose CFM or Washington Group short set, whichever we choose, we're going to do it. We're going to collect the data. We're going to have follow-up actions for actual programming for inclusive education, and it's only in the small meetings that you can get these decisions. So we can be inclusive, but if you want to really make a change, you have a meeting with no more than 5 or 8 people, and that they're the people close to the top. And in humanitarian settings, we do have the INGOs have the power to do our EMIS, because sometimes the government EMISs are not so functional. That's in development settings, it's a much longer process to get government EMIS and government systems on board. But if in our own places where we're directly running temporary learning spaces, we can like have an example, get our own house in order, then, you know, and that also affects millions of children. Sometimes children will be in refugee camps for all of their education. So we can make a difference there very directly. So I just suggest some kind of smaller breakout advocacy meetings with very key decision makers.
Thank you. Oh, Mario, you had your hand up. Would you put it down?
Yeah, I can go after Guy.
Guy, okay. I seem to be losing my listing of people with their hands up. So go ahead, Guy.
I really like what Maya said about getting something done. I just think we have to be a little bit careful about advocating for a particular tool when we're not absolutely sure that it's the right tool, or if it's the right tool, how it can be used effectively. And I wonder if that sort of advocacy is something that should be happening in a year or two's time, when we're clear about the best way of identifying these children within schools and helping them.
Yeah, I mean, if I may jump in, no, it's a great point, and there's one thing. I mean, like, I also agree with Maya that at some point we should just put our heads together and then just go on with the tool at some point after so much testing. But at least from the ECW perspective, we are trying to do two things. One is that we are going to work with INE in the next 2 years. We're supporting basically their inclusive education task team. And as part of this program, we have some outputs that will come out of this program related to the GDS. So, I mean, like, these are going to be products that should help implement some of the recommendations coming out of the GDS, the Global Disability Summit. So some of it might be just looking at what is the evidence base, what are the tools that are out there, and then just come up with this kind of recommendation to understand, I mean, what is actually the tool that could be fit for purpose in certain contexts, in our case, emergency settings. And then, of course, there's, advocacy, and also just decision making about what tools should be used for programming. And at least what we are trying to do now is at least to champion the use of the child functioning module. I mean, it's something that it's recent, but we are pushing for that. There's no policy at the moment whatsoever, but whenever there's a new program, which is the case now, we are basically advocating for that. So first of all, looking at whether there are existing data, and if there are no data, to assume a 10% of children with disabilities in a specific program. And then if there are no data, to budget and do an assessment using the child functioning module. Since we do not have like a test or something in emergency context for the CFM TV. But that's the idea. That's why we are trying to do this, because then the next step would be possibly to recommend the use of this tool in settings that are like emergency affected. So that is, let's say, what we're trying to do. So to test first and then recommend after that, and then to compile evidence and see whether there is a better tool, or that is actually the tool that we should be using in education and emergencies in this case.
Good. We're almost at time, and I want to respect everyone. You've given us a lot of your day, and we really, really appreciate that. Maybe as an immediate next step, as someone requested that we provide the email addresses and contact for everyone on the call. I'm assuming that's okay with everyone. I guess we should have asked to begin with, but we have the recording, we have the comments. Maybe what the Secretariat should do is kind of go through some of the major points that were raised, try to do some summarization, and get back to you with some ideas about how we might proceed, some questions about, you know, things like, you know, how often should we do it by topic? Do we just want to have kind of updates as people go? And we would appreciate it if you'd respond to those questions. Guy just asked about making the recording available. I'm fine with that. I hope if anyone's uncomfortable with that, we can just ask. But if you're okay, we can make that available. I think we can make it available. Can we, Heidi?
Yeah, so I was maybe thinking two ways that we could make it available. We could send it around along with a list of participants, so that way you have both. And then we may also write a news item in the Washington Group Secretariat webpage, sort of giving a very broad description of what this meeting was, and then include the recording there, if you guys think that's okay.
If you know of other people who, other groups that we should include, please let us know. And again, this was really just who we knew because you contacted us, but we're happy to expand it. And we'll try to get back to you as soon as we can, and we can decide how it's best for the Washington group to organize this, and we may bring it up to the child functioning work group to see if it's something that they would like to have under their purview. It's still a Washington Group Secretariat activity, but it may be that those are the people who are actually most involved and are most interested. We can get back to you on that. So I don't know, does anybody have any closing words? If not, thank you all for agreeing to participate and to be so open with everything that you're doing. And it was really excellent for the Secretariat. We feel way more informed than we were. We'll send you information about the annual meeting, maybe some ideas about what we might do, and also what we might do with GLAD. And anyone who has a little bit more structured idea of what we might want to do with the Global Disability Summit, let us know, because we're not connected in some of these things as well as you are. Since we generally would do that kind of through our governments. And so if there's something we can do, let us know and we'll try to facilitate it. So Mario, did you have the closing word?
No, I didn't want to add that, privilege, but it's just about the Global Disability Summit, because at the moment it's not entirely clear on how it's going to be structured, what are going to be like the different sessions. So probably for that we might hold off, but it will come soon, I guess. So because there's also like a working group in the GLAD that it's taking that forward, particularly in NORAD. So we can just wait for that, but then inform them.
And we'll also mention something about reporting back to the GLAD Intersecretariat Working Group, in whatever it's called, the Inclusive Education Working Group at their next meeting. So thank you all very much, and we'll be back in touch. Have a good day, evening, wherever you are.
Thank
Bye.
you. You too.
Bye, everyone. Thank you.
Bye.
Thank you. Take care.
Thank you so much. Bye.
Bye. Thank you so much.